so fun.
Well, all of I want. David,
All right, so
are you gonna go get one?
you've had a long day at work. Come home. You have a lot of responsibilities. It's the end of the day, and you're tired. You crawl into your bed, put your head on your pillow, and as you drift off to sleep, what do you hear? You hear your infant screaming from the nursery and waking you up. Does that sound peaceful? I think not. So what we're going to talk about tonight is sleep training. And what sleep training is the process of training your child to sleep through the night. Basically, not going in there every time they cry for any one thing. So we'll talk about the factors involved with your specific child. We'll talk about 2 different kinds of sleep training, as well as some other factors as well. So starting off, reasons to sleep train. The first is obviously the health of the child. For a child to get a solid night's sleep is obviously important for a number of reasons, including just the more a child sleeps, the less likely they are to be prone to sickness. It's also important for the parents to get a full night of sleep for obvious reasons, so they can be patient with the child, so they can enjoy their time with their child. Third is, if you have any siblings, it's also important for them to get full nights of sleep. So, let's see what this. Another reason you want to sleep train is for consistency in your schedule. So, I have some dry mouth, excuse me, I can't even talk right now. So consistency in your schedule, you'll want to. Thank you, I appreciate that. So your consistency in your schedule, you'll want to go out and have a life while you have this child, but as your days go on and your baby has an inconsistent sleep schedule, you're going to have a hard time, keeping those plans with your friends. So say if your baby has, a 12 o'clock nap planned out, and you schedule your lunch for 2 o'clock, you won't have a problem. The baby will go to sleep at 12, wake up at 1:30, and you can go have your lunch. So that's a really important thing and a good detail to remember. And before we get into the specifics of, sleep training and everything that goes into it, it's always important to keep in mind that your child is an individual and that anything I say is talking in the general. So everything I might talk about won't necessarily pertain exactly to your situation. You'll want to take into account any special needs your child has or any special family situations or work situations that you have going on. So doctors recommend that you start sleep training at 3 months old. The primary reason for this is because at 3 months old, most babies are back over their birth weight. Babies lose weight generally in the first month or so out of the womb. So when they get back over their birth weight, you no longer have to wake them up every 3 hours to feed them through the night. So that's when you can start sleep training, is when you no longer have to do those nighttime feedings. So once you get into a habit of starting sleep training and you feel like it's going well and you see progress, do not be alarmed or do not feel discouraged when the baby or the infant regresses. There's a number of factors that can cause regression in sleep training, being teething, when their teeth are coming in, that can cause pain and discomfort, which will cause them to wake up throughout the night, or general sickness will also do this. And as well as any changes or distracting events that happen throughout any individual day can cause night terrors or anything else like that, which will cause them to wake up and not feel like they're in their normal schedule. Lastly, you'll need to consider, are you as a parent ready for sleep training? It is something that you have to dedicate yourself to. The process can be long, it can be hard, and it can be trying. It can test your patience, and the worst thing you want to do is start a sleep training regimen and then stop and then start again, because that will really hamper and won't really solidify any long-term schedule for the child. So now we'll get to specific training techniques for sleep training. So I used two references, two books that we had. The first one was What to Expect in Your First Year, and then the second one was Baby Wise. So the two methods, the first was the cold turkey method, and this one was out of What to Expect. If you've ever heard of a cried out method, the cold turkey method is basically where you remove all sleep aids from the baby's crib, and once you're sure that the baby's been fed and has a clean diaper, you put them in there. Once they fall asleep, then you leave them. And basically, it can be hard for parents to ignore the cries, but you do that for several weeks, and then that should be done. The second is the gradual withdrawal, and that one is found in the book Baby Wise. And this is basically a more steady and slow approach where you gradually withdraw sleeping aids such as pillows and blankets from the crib or little stuffed animals, as well as reducing the number of times you actually go into the crib area to soothe the baby throughout the night. So those are the two ways, and I know, we talked about reasons and whys of why you need to sleep train babies, and the two methods of cold turkey and gradual withdrawal. I hope one day when you guys have children that you will take that into consideration.